How do liver enzyme tests indicate cholestasis? Have you ever wondered how liver enzyme tests can reveal issues like cholestasis? Cholestasis is a condition where bile flow is impaired, and liver enzyme tests can provide crucial insights into this problem. These tests measure specific enzymes in your blood, and the results can indicate whether cholestasis is present. One of the key enzymes measured is alkaline phosphatase, often abbreviated as ALP. In cases of cholestasis, ALP levels can rise significantly, sometimes reaching 3 times the normal upper limit. This enzyme is found in the cells lining the bile ducts. When bile flow is blocked or impaired, these cells releases more ALP into the bloodstream. However, it is important to note that elevated ALP can also come from other sources, such as bone or placenta, so it is not solely indicative of liver issues. To confirm that the elevated ALP is related to the liver, another enzyme called gamma-glutamyl transferase, or GGT, is measured. GGT is specifically associated with the bile ducts and is usually elevated alongside ALP in cases of cholestasis. If ALP is high but GGT remains normal, it is less likely that cholestasis is the cause. Bilirubin levels are also important in this context. Bilirubin is a substance produced when red blood cells break down, and it is normally excreted in bile. In cholestasis, bilirubin levels can rise due to impaired bile flow, leading to jaundice, which is a yellowing of the skin and eyes. Elevated bilirubin indicates the severity of cholestasis but does not specify the underlying cause. Both direct and total bilirubin levels may be elevated. Aminotransferases, including alanine aminotransferase and aspartate aminotransferase, are also measured. These enzymes are markers of liver cell injury and may show mild elevation in cholestasis, but typically not as high as ALP and GGT. If ALT and AST levels are significantly elevated, it may suggest liver cell damage rather than cholestasis. When liver enzyme tests suggest cholestasis, further investigations are often necessary. Imaging techniques such as ultrasound, computed tomography, or magnetic resonance imaging can help identify the cause, whether it is due to bile duct obstruction, gallstones, tumors, or liver diseases. In some cases, a liver biopsy may be performed to confirm the diagnosis and assess liver tissue changes. In summary, liver enzyme tests indicate cholestasis by revealing a distinct pattern. Elevated levels of alkaline phosphatase and gamma-glutamyl transferase, with or without increased bilirubin, and relatively lower elevations of aminotransferases. This pattern reflects impaired bile flow and is essential for distinguishing cholestasis from other liver conditions. If you have concerns about your liver health, it is always best to consult a healthcare professional for personalized advice and guidance.